I've just completed a sick visit exam on Sam Olson, a 2-year-old who was brought in by his mother, Anna. She reports that he's had fever and has been pulling at his ears for the past 2 days. The fever has been constant, appears worse at night, and he appears to have more discomfort when he is lying down. She's been giving him ibuprofen, 5 milliliters every 5 to 6 hours, and has noted some relief of the fever. However, it does return. She states he's more irritable, more restless, and is getting poor sleep. He is still breastfeeding, but he's having difficulty latching and has had a decrease in his oral solid food intake. She denies any notable aggravating factors. The only medication he takes is the ibuprofen. He has no known allergies and no medication intolerances. His medical history is unremarkable. He's had no major medical incidents and no surgery or hospitalizations. His family history includes his mother and father who are healthy and 2 older brothers who are also healthy. Mom denies any notable similar symptoms in any of the family members. He does attend daycare, and she has no knowledge of any other children having similar symptoms. He is not exposed to smoke, cigarette smoke, alcohol, or drugs. Other symptoms, review of symptoms, were that he has had no notable cyanosis, no difficulty breathing, such as use of accessory muscles. She does report a non-productive cough. She's reported that he has not had any eye drainage or excessive tearing. However, he is able to produce tears. He has some clear nasal drainage. He has a non-productive intermittent cough and no difficulty breathing or use of accessory muscles. He's had the nasal drainage that is clear. She denies any throat issues like swallowing or redness in the throat or hoarseness. She states that he's had no vomiting or diarrhea. His diaper changes are consistent. He is urinating about every 2 hours. She's noticed no abnormal muscle movements or seizures and no lymphadenopathy. On physical exam, his blood pressure is 95/58. He weighs 28 pounds. He is 2 foot 11 inches. His pulse is 98. His auscultation or cardiovascular was that he has regular rate and rhythm, no murmurs, clicks, or rubs. His respirations are 25. Anteriorly and posteriorly, his lungs were clear. Bilaterally, no rales, rhonchi, wheezing, and no use of accessory muscles. His O2 sats were 98. He does appear ill and fussy, but he's consolable by his mother. His anterior fontanelle is closed. Bilateral ear canals are without redness or drainage. However, his tympanic membranes bilaterally are erythematous and bulging, and the bony landmarks are non-visible. His on pneumatic otoscopy, his tympanic membrane is minimally mobile, and his hearing, he responds to the whisper test, and so he appears to have no hearing deficits. There is no discharge from his eyes. His nose has notable mucosal clear discharge from both nares. And his throat, his pharynx was 1+1+, tonsils without redness or any drainage. His abdomen's soft and non-distended, and his musculoskeletal is mildly reduced, which is consistent with his acute illness. Some differential diagnoses would be acute otitis media bilaterally, otitis media with effusion, and upper respiratory viral infection. His cough and nasal congestion, low appetite are consistent with an upper respiratory infection. However, his fever and his erythematous and bulging tympanic membranes are more consistent with otitis media. Otitis media with infusion includes the fluid without the acute inflammation and infection. So I would rule that out and go with the primary diagnosis of acute otitis media, which Sam presents the hallmark signs being that he has the fever, the irritability, the pulling of his ears, both ears, the otoscopic findings of the erythematous bulging tympanic membranes without his bony landmarks and being visible, and the inflammation and infection of his middle ear. It often follows an upper respiratory infection. So what I'd like to do is give him the first line antibiotic for children 2 years and younger, which is a high dose amoxicillin, 80 to 90 milligrams per kilogram per day, which would be given in the 400 milligrams per 5 milliliter oral suspension. And I would give him, based on the calculations of his weight, 7.2 milliliters by mouth twice daily over 10 days. Also, Anna can continue giving him the ibuprofen as she has been giving him. And some non-pharmacological interventions would be some warm heat to the ears for comfort and to encourage the increased fluid intake as much as possible. And she should continue breastfeeding as tolerated. Diagnostics, there are no additional diagnostics needed. Educated the mother on completing the full day of antibiotics and instructed on adverse reactions of antibiotics such as rashes, vomiting, and diarrhea, and to discontinue immediately should that occur and to give us a call. Reviewed the symptoms of worsening illness, encouraged her to continue with routine immunizations and to avoid secondhand smoke as she has been doing. There are no necessary referrals. As far as cultural concerns go, the mother seems to have no language barriers, and she and Sam seem to have a great bonding. I'd like to see him back in 7 days to check how the antibiotics are working and the resolution of the infection, and for her to return sooner should the symptoms worsen or not become improved in 48 to 72 hours.